Question number 7, Sarah Dowry.
Thank you, Mr. Speaker. My question is
Order. Order. Sarah Dowry, question number 7.
Thank you, Mr. Speaker. My question is to the Minister of Health. Can he confirm that rheumatic fever rates have dropped?
Order. I'm now giving the last warning to the Minister. If he continues to interject like that and cause disruption, I'll be asking him to leave the chamber. Sarah Dowry, could we start that question again?
Thank you, Mr. Speaker. My question is to the Minister of Health. Can he confirm that rheumatic fever rates have dropped 24% since 2012, following the government investing more than $65 million on a range of initiatives to combat the disease?
Mr. Speaker.
The Honourable Dr Jonathan Coleman.
Mr. Speaker, yes, I can. The government is committed to making progress on issues that affect vulnerable children. In the last few years, we've made great progress reducing the number of first episode rheumatic fever hospitalisations by 24% since 2012, including a reduction of 36% for Maori children and 31% for Pacifica children since 2013. This morning, I visited the Pororoa Union and Community Health Service, which operates a sore throat swabbing drop-in clinic, and it was great to hear the stories of families whose health is benefiting from these new services. They are doing a great job there at that health centre.
Supplementary.
Supplementary question, Sarah Dowry.
To the Minister, what are some of the initiatives the government has invested in to reduce rheumatic fever?
Mr. Speaker.
The Honourable Dr Jonathan
Mr. Speaker,
Coleman.
to achieve these reductions, we've established 300 drop-in clinics and 200 school-based services covering 25,000 children. We've reached over 3,000 families per year with the Healthy Homes initiatives in all high-incidence areas, and we've engaged 30,000 Auckland and Wellington Pacifica families through home visits and community events to raise prevention awareness. These initiatives are making a difference, but there's more work to be done towards achieving the Better Public Services target of reducing rheumatic fever by 2/3 by June 2017.
Question is this a supplementary question?
Supplementary.
Supplementary question, Barbara Stewart.
Thank you, Mr. Speaker. Can the Minister confirm that the June 2015 Better Public Service interim target of a 40% reduction in first episode rheumatic fever hospitalisations was not met, and in fact only a reduction of 14% was achieved?
Mr. Speaker,
The Honourable Dr
New
Jonathan
Zealand
Coleman.
First always wants to rain on the parade, but look,
Order,
the fact is,
just answer the
this
question.
is a tough-to-achieve target that no other government has ever tried to tackle. Last year, there were 135 new cases. The year before, 175. That's great progress, and the member should be celebrating and supporting it.
Point of order, Mr. Speaker.
Order.
Point of order.
Point of order, Barbara Stewart.
I seek leave to table a Ministry of Health report titled Rheumatic Fever Prevention Program Update, stating that overall
Order. There's no need to add any more. I just need to check, is that a report that's available on the web for members to get?
No.
On the basis the member said it's not. Order. I will accept the member's word. The member said it's not easy to obtain that report. On that basis, I will put the leave and the House will decide. Leave is sought to table a particular Ministry of Health report on rheumatic fever. Is there any objection to being tabled? There is objection. Question number 9.